Hi, this is Steve Rowe, Executive Director. Today is Tuesday, January 4th, as I record for a video that will get uploaded to you on Wednesday, January 5th. Happy New Year. I want to start the message today by thanking our dining services team for all of their work through the holidays, really starting with Thanksgiving all the way through New Year's. I know things didn't go exactly as we would have liked at East on Christmas Day, and I'm sorry for that, but we will learn from it and do better next time. I was here in the community room on Christmas Day as a volunteer to try to help out in whatever way that I could, but our staff really had things very well under control. There were also lots of outside volunteers here on Christmas Day to try to help out. And I just heard really positive comments from many of our residents as I had a chance to talk with people both that day and after. And also on New Year's Eve, I got some very positive comments about dinner on New Year's Eve. So thank you for all of the work, dining services. Your efforts are very, very much appreciated, and it sounds like it was a pretty successful holiday season for our dining services team, so thank you to them. Also, before the COVID update, I want to just thank you, our residents, for your incredible generosity with the holiday gift. Once again this year we set another record for your generosity, and over $250,000 was contributed to the Holiday Gift Fund this past year. A full-time or a full share of that holiday gift was over $1,300, which is just absolutely amazing. And sincerely want to thank all of you who contributed to that holiday gift fund and made a difference in the holidays for our staff. So thank you. I am optimistic that there are better days ahead for us as it pertains to COVID, but the last couple weeks have certainly been rough. Throughout the Oak Knoll community, both residents and staff, we've had many exposures, so we've kind of been apprehensive about what might be coming. So a number of exposures. We've had 5 employees who work in either the health center or assisted living test positive. Fortunately, a couple of those positive tests came after people had been off of work for a little while, so there was no direct exposure to our residents. And whenever we have a positive case with staff members in the health center, we have to go through testing of residents. And that occurred both last Wednesday and Monday this week. So Monday, January 3rd was the most recent testing of our health center and assisted living residents. Fortunately, we still have no cases with our health center residents or assisted living residents. So that's good, but we've got a lot of employees out right now because of potential exposures or positive tests, and they just need to be out for at least 10 days from the onset of symptoms and test negative. So a lot going on there that is just unfortunate. And by the time you view this video on Wednesday, you will also have received a memo that Kim and I wrote today to let you know that we have 3 positive cases within our independent living population. 2 of the 3 are a couple. So they're obviously related, and they had been traveling over the holidays, and when they got back to Oak Knoll, tested and were positive. The 3rd case clearly was not related to the first 2 resident cases, but that person also tested positive on Monday, and each of those 3 individuals is quarantined in their apartment. We're trying to provide support to them through this process, and we'll do everything we can to help them through. some of you have asked, since the case count seemed to be picking up and it's like we've got a lot of potential exposure, should we or could we stop visitors from coming into the building? And Kim and I have talked about that and have responded with no, we're not going to do that. And here is our thinking. When we restricted visitor access back in 2020, it was at a time when federal regulations for the nursing home level of care dictated that we could not allow visitors into the building. And that lasted for several months and was very, very difficult for people because of the isolation that resulted from not being able to see their loved ones. We got really good at doing Zoom meetings and things like that between and FaceTime with residents and family members, but certainly not ideal. A few months later, the federal regulations did a 180-degree turn, and we could no longer not allow visitors into the health center. And those regulations continue to exist. We have to allow visitors into our health center level of care, and it's really difficult for us to consider putting more restrictions on independent living than we have on the most frail and dependent residents who live at Oak Knoll, those living in the health center. So that's why we have chosen not to restrict visitor access. We can't do it for the health center, and since we can't there, we're not going to do it for independent living. We do encourage people who have concerns that obviously the safest place to be is in your apartment and isolated. If you don't come in contact with anybody else, you can't possibly contract the COVID virus. Some people can live that way, many of us cannot, but that always is an option, and we are fully prepared to deliver meals to your apartment to help you be isolated if that's what you want. We will be, and starting today, we'll be spreading the tables out further within the Oak Room and at Scotty's. We've removed some tables from both of those restaurants, just trying to maintain higher levels of distance between tables to minimize potential exposures. But just know that we have talked about the visitor access question and have landed for not restricting access any further. We will continue to require that visitors screen, that they wear masks in the common areas for sure. I would recommend that they wear masks in your apartment personally. We know that the three independent living residents who tested positive, all three of them had been vaccinated and had received the booster. So it's like hopefully they don't get as sick as they could have because of the vaccination, but it's still very possible, as we're seeing, to have a positive COVID test and some symptoms because of that. COVID activity in Johnson County continues to be high. It seems like it's getting worse steadily. We are currently up to about 90 new cases per day over the most recent 14-day period, and I've got data through Tuesday, December 28th. The positivity rate had increased when I looked last week, and it was 11% for the most recent 2-week period. And I promise you it's going to go up when we have the new data this week, because the 7-week or the 7-day positivity rate was more than 13% for Johnson County. So it's that alone is going to drive the 14-day rate up as soon as we get through a full 2-week cycle. So still lots and lots of COVID positive activity within the county, and we just encourage you to try to stay as safe as possible. When you're out, please wear a mask, especially if you're in a crowd of people. I have been going to basketball games at the arena. I always will wear a mask, and for the game last night, I actually double masked. I saw that recommendation sometime fairly recently. I don't know if it's valid or not, but it's like it just made me feel a little bit better to have 2 masks on. So So I did that. I know it's nervous time for lots of us. Just hang in there. Better days are ahead, and we will get through this together as we have for the past 22 months. Our nursing leadership is working incredibly hard to try to keep everything going. We're doing it with some staff members who clearly can't work because of potential exposures or because of positive COVID tests. So please, as you see Kim or Sarah or Jen or Jacqueline or Sheila, or any of our nurses, please give them some encouragement and let them know how much you appreciate their efforts. We truly are in a good place here because of their leadership through the past 22 months, and we will get through this together. I hope all of you are well. Thanks for listening, and we'll see you again in 2 weeks. Take care.